Hello, my name is Paige DeCrody, and I am a licensed practical nurse. I have been a volunteer receptionist as well as an LPN at People's Health and Wellness Clinic. Today, my presentation is going to be on why I am advocating for discontinuing the use of paper medical charting and installing and implementing electronic healthcare records, or EHRs. On slide 2, you will find why there are several reasons to go through with this transition. There are a few ramifications. They include financial penalties, which the federal government will give to us if we do not implement EHRs by the year 2015. Another ramification is medical errors. This is one of the biggest things that is problematic to delivering quality health care to our patients. Lastly, the ramification of poor patient outcomes. Some of that is directly related to the errors that can be created, but it's also to do with patient satisfaction. The solution, electronic healthcare records. Today I will go through the project budget of how we can implement EHRs, and at the end there's going to be a conclusion and a chance for everybody to ask questions. So on slide 3, I just have a couple of pictures that shows you to the left what it looks like now, the paper medical records. It's very disorganized, papers can go missing, things fall apart. But then look over to the right and we have a mobile device that'll carry a laptop computer with our EHR installed, and it'll create more streamlined care and documentation. On slide 4, I have for you a quote from the National Electronic Health Record Interoperability Chronology from Military Medicine. It says, for each year that a system is not implemented, Medicare and Medicaid payments will be reduced by 1%. That means after 3 years, 3% reduction, and we as a free clinic, we cannot afford that. On slide 5, I just have a symbol that shows you an example of what you might see in an EHR when a medical error is about to occur or when a medical error can be prevented. EHRs prevent medical errors by providing these clinical alerts and reminders, and paper charting, it's not as obvious. So, for example, there might be a drug-to-drug interaction or a disease process going on within the patient that contraindicates giving a certain medication or a certain test or a certain treatment. Also, you might see this if lab values are out of range, vital signs are out of range, all sorts of things. The ramification of poor patient outcomes. We can expose our patients to potential safety problems with our paper charting, and there's pretty serious consequences, as well as the risk of losing licenses for providers who are unable to get the big picture of what's going on with their patients. The solution, EHRs. So what are they? EHRs are basically computerized digital versions of the classic paper medical chart, which has been used up until now. So why implement EHRs? The Medicare and Medicaid financial incentives. Actually, healthcare providers not only can avoid the penalties, they can actually have some subsidies given to them if they do implement meaningful use. So it also prevents medical errors and improves patient outcomes and satisfaction. EHRs are designed to contain and share information from all providers involved in a patient's care. That's the difference between an electronic medical record and an electronic health record. This EHR will travel with the patient literally wherever they go, whatever facility, whatever discipline they're in, so that everybody, the interdisciplinary team, can see what's going on and get the real picture of where and what's going on with the patients so they can better treat them. On slide 9, there's just a funny little comic for you to look at. It says, The last time someone went into medical records, they were lost for a week. And if you came into the HWC, you would see a very similar system going on with our records. Slide 10, solution components. So how are we going to solve this problem? First, we need to purchase the hardware and the software. Since we already have wireless connectivity with our internet and a few hardware devices and computers at the facility, we don't need to budget in for many more. 2 more laptops should be enough, and 2 mobile carts. Then there's the training for our staff. That is going to range in hourly rates depending on if it's just the receptionist or if it's a medical doctor, which obviously there's a big range there in pay. But I have come up with a plan and a budget that will take into account all of our employees and our volunteers. Then, after we implement, we're going to do continuous evaluations of how the EHR is working. Everybody can give feedback, but we're also going to be taking surveys. Phase 1 of the evaluation process is going to take in all that revolving information and data that we collect. Then we'll have a second time where we can do a training session where we work out all the kinks, and a final evaluation phase will be conducted. The budget includes $5,704 for the 2 laptop computers that are professional grade, and then we have, for the laptop carts, and then $1,600 for the laptop. $34,000. The biggest investment is in the vendor, software, and installation process. The project director and trainer is going to, those 2 people, $43,680 to pay for them, and they will be there for IT advice, any sort of problems that staff or employees come to randomly where they need some help. And then staff training is going to be $12,045. That's the 3 training sessions. Everybody needs to come to at least one of the 3 sessions. Total cost is going to be $97,029. In conclusion, this is cost effective. We're going to avoid penalties. We're going to, hopefully, if we get on the ball now, pick up some of the benefits from the subsidies while they're still lasting. Then we'll increase our organization and accuracy, improve patient satisfaction through optimal treatment options and diagnosis, and also our employee satisfaction through the best practice and medical errors and the EHR. We'll also be protecting the licenses of our providers because they will not be making as many mistakes. So this is a win-win situation for People's Health and Wellness Clinic and for our patients. Thank you. And does anybody have any questions?